Good afternoon, everyone. I'd like to send a warm welcome to you all for attending today's Livewell launch. My name is Pete Dawson. I'm the Built Environment Manager at Play Services team at Essex County Council. Today you will hear from some of the main contributors and collaborators of this new initiative that will provide you with an opportunity to learn about the Livewell programme, its benefits and outcomes, and how it will have a positive influence on placemaking across our growing communities in Essex. You'll also learn about how you can get involved, both from local authority side, developer side, and consultant side as well. Now more than ever, we see the importance and value of health and wellbeing in society. Certainly, as we plan for the future development growth in Essex, health and wellbeing is recognised as one of the main contributing factors in influencing quality of life when choosing where to live, where to work, and being part of the wider community. Following on from yesterday's launch of the Building for Healthy Life, the Livewell programme echoes much of the content and aspirations of this new national initiative. The Livewell programme for Essex goes a step further by linking health impact assessment, HIA work, with the voluntary accreditation scheme, which recognises and rewards developers for their contributions to the health and wellbeing agenda. As you'll learn from this afternoon's launch, the Livewell programme incorporates a bespoke design review panel to assess developments in accordance with the Livewell principles. Developers who successfully engage in this process will be rewarded with a Livewell accreditation. More on this to follow shortly. We kick off today's launch with a run through of the Livewell Development Accreditation and panel process. This will be by Jeremy Potter, Spatial Planning Services Manager at Chelmsford City Council. Following Jeremy, Andrew Taylor from Countryside Properties will provide a developer's perspective on the programme. Then at 12:30, Laura Taylor-Green, the Head of Health and Wellbeing at Essex County Council, and Roy Warren from Sports England will present the Essex Healthy Places programme. And then we finish up with a Q&A to the panel, which will consist of Jeremy, Roy, Laura, who will be joined by Michael Chang from Public Health England. Details of the programme and links to the other information that you might need will be made available after today's launch. As we run through each of the presentations, feel free to post questions for the Q&A at the end, and we make all questions available and answers to them at the end of the session. So now over to you, Jeremy.
Thank you very much, Pete. Hopefully everyone can hear me okay, and also they can see the first slide of my presentation. Good afternoon and welcome to sunny Chelmsford. I'm, as Pete says, Jeremy Potter. I'm the Spatial Planning Manager at Chelmsford City Council. I'm also the Chair of Essex Planning Officers Association, APOA, and I am really proud to be involved in the launch of the Livewell Development Accreditation event. And it feels like such the right time to be doing this. And when the importance of active travel, green space and general health and wellbeing is so important to everyone's day-to-day life. So it feels like a really good time for us to be doing this. So what I'm going to cover, I've only got 15 minutes, so I'm going to have to speed through fairly quickly. What I'm going to cover, I've got a short presentation where I'm going to cover why we thought the scheme was needed and how it's different from other accreditations. And I'm going to go through the 3 strands of the scheme and also the 6 themes that leads to the full Livewell Development Award. Now, I've got to say, this has been a bit of a journey for us. So I'm going to briefly also talk about how the scheme has evolved and also the work that's been done with development partners, and then try and sum up and hope that the scheme will deliver and achieve, and most importantly, how we propose to measure the outcomes going forward. So that's essentially what I'm going to cover. So why another accreditation? So aren't there enough already? And there are lots, as Pete was saying, and some of there's some complementary accreditations out there. Of course, there's some great schemes, and there's likely to be a bit of overlap. But the thing that we really wanted to focus on was how health impact assessment is embedded from the really earliest possible stage into new development. So some of these accreditations focus on buildings or on homes, or some are looking at specific new strategic developments such as the health of new towns and placing health and well-being really at their heart, and that is exceptionally important. But as part of producing Chelmsford's new local plan, which was adopted in May, we wanted, as I said, to focus on how health impact assessments can work in practice into new development, and then through policy, through our local plan, master planning, and then actually coming through via planning applications. But also for us to, crucially, then to test those new developments to see, once they're built, to see whether they've actually implemented those objectives, and then also have an ongoing monitoring process to actually monitor those outcomes, like changes in behaviour and health improvements. Because what we want to do, these principles are fantastic, but what we want to do is actually achieve the change that we know is required. So, as I said, increasing health and well-being in new development cuts across a number of national and local policy objectives. So I'm not going to go into those. You can go and visit some of those bullet points as we can see on the screen now. But our new local plan, it is allocating a new garden community, but it includes active design principles and sustainability and sustainable and active travel at its heart. So we wanted the health impact assessments, the HIAs, and healthy checklists to be used as a real tool for developers, rather than seen as a bit of a tick box exercise, something that developers have to do along with all the other requirements that developers have to face in relation to submitting a planning application. But also, it was a really good opportunity for us to provide public health practitioner support to planning colleagues to understand and interpret what HIAs are actually saying, because planners may well ask for health impact assessments to be submitted, but it's what they say, interpreting what they say and actually implementing that into new development that's the key, that probably hasn't been as effective in the past. And we feel that the new scheme is a way in which we can share that knowledge and share good practice. So the process really started, just really briefly, by thinking how we can use our health and wellbeing plan, and lots of local authorities have these, and they have really, ambitious visions to try and improve people's health and wellbeing, reduce health inequalities. And our health and wellbeing plan was like that, but we've got some agreed priority areas within that. But rather, it was an evidence base for our local plan. But rather than just have that as an evidence base sort of sitting behind the local plan, we wanted to actually see whether our policies can implement some of those agreed priority areas that you can see on the screen there, and also about those better links between our own and the county council's public health practitioners and spatial planners to try and create that connection. The question arose was, how can we ensure developers, large and small, are really thinking about health and wellbeing in the same way that they might think about highways or transportation issues or landscape or other structural elements when you're thinking about a plan right at the beginning, thinking about a development proposal right at the beginning, whether that's a pre-application, whether that's site planning or master planning, all of those things that really look at the genesis of a development, making sure that we've got health and wellbeing as one of those really important factors. So for those that don't know Chelmsford, we're located right in the middle of mid-Essex. We've got really good transport links. We've got a population of nearly 170,000 people, and over 100,000 of those live in the city of Chelmsford, which is essentially Britain's newest city, created city status in 2012. We are relatively prosperous, but we do have pockets of deprivation in the urban area of Chelmsford, which the health and wellbeing plan is seeking to address. And also we want to ensure that our new development really exemplifies some of those health and wellbeing practices as part of the development. So like many places, we're accommodating significant growth. It's about 1,000 homes a year, new homes a year. But one of the strategic priorities underpinning the local plan is essentially the creation of and the promotion of healthy communities by creating the environment for active and healthy lifestyles. So rather than focusing on sort of health and well-being as a specific subject within local plan, what we've tried to do, or what we have done now, is actually embedded those requirements into our placemaking policies to make it a place-focused requirement rather than a separate health and well-being requirement. And we've used Sport England and Public Health England's active design principles embedded within our policies. So what you'll know is that there's all sorts of pressure from new development to provide social and economic and environmental benefit. And sometimes the planning system struggles a bit to balance those sometimes competing objectives. But the partnership that you can see on the logos on the slide there are bodies and organisations that have come together to develop this accreditation to help acknowledge and reward developers who think about these issues in a holistic way. And we hope to be awarded a Livewell accreditation will be a benchmark, not only for developers, but for purchasers of new homes and provide good marketing for developers. And most importantly, improve people's health and well-being with all the benefits that has to individuals and society as a whole. So I haven't got an awful lot of time, so I need to press on, but so I just need to go through, I'm going to go through with you a little bit of an overview in terms of what the accreditation is. Essentially, there are three main elements. The first is a developer charter, and any developer can sign up to this, and this allows them, developers, to tap in to the knowledge and expertise, in particular, of local authority public health practitioners, to actually tap into that knowledge and to ensure that the HIA, the health impact assessments, are really doing the job that we want them to do. And we felt that that was important, especially for smaller developers who may fall under the 50 home threshold. So we have a threshold of 50 homes that have to submit health impact assessments, but they still want to embed those Livewell principles and get recognition from the Livewell process into their development. So we felt a development charter allows that to do it. It's based on an annual review and it promotes that commitment from a developer, but then the training and advice provision from the local authority, and the local authority being both the City Council or a local authority, as well as a second tier authority being a county council. Then the first stage of the actual accreditation award is for design, and developers are assessed and proposals are assessed on how their designs have actually embedded healthy design principles and actually have demonstrated through the design and that they've responded to the outcomes of the health impact assessment. This is assessed by the local planning authority in conjunction with public health practitioners that I've spoken about. And a Livewell Design Award can be awarded to developers through that design process. And the way that happens is that when a grant of planning permission happens and the HIA has been assessed by the local planning authority, then through the grant of planning approval, a developer, a proposal is notified of their eligibility when planning permission is granted. So that's the design side of things. But I think what we really wanted to make sure was that the second stage is actually making sure that that design is actually created, is implemented. And the second stage assesses the actual development once built. So a credit-based scoring system, some being essential, others being desirable, are awarded across 6 categories. So there's 6 categories on the screen: the design of homes and spaces, active environments and active design principles, the environmental sustainability, supporting communities, access to healthier food environments, and education, skills and employment. And as I said, there's a credit-based process, and that leads to the inevitable kind of bronze, silver and gold award, subject to approval by a panel. And now a panel has been set up, and that's a kind of a Livewell design panel, which is a subset of the Essex Quality Review panel. That at the moment is chaired by Michael Chang, who's on the call, will be joining us on the Q&A. And we think that why would developers actually apply for this after they've built it? And that may be a question that may be coming forward in people's minds. But we think actually what you can do is first phases of larger developments can be assessed and awarded, and then case studies are built up to allow developers to point to awarded schemes in other areas and to demonstrate the principles are happening in practice for others in the future. So actually it is really important to make sure that the design award translates into something that happens on the ground, and then something that's tested against those criteria by an independent panel. So one of our local plan sites at West Chelmsford, this is promoted by Crest Nicholson, has been one of the pilots, the main pilot. It's a medium-sized greenfield site with a new primary school, a neighbourhood centre, green space, and a travelling show person site at TSB. Effectively, the development of the master plan has embedded the active travel principles. So we've got a linear park in there. We've got the community focus, the school and the community and the neighbourhood centre in the middle of the site. Now, sometimes developers like to have them on the edge, so they have more visibility from the road for retail and those sorts of things. Actually, but what we wanted to do was get it in the middle, so people were much closer to everyone on the development. Active travel is embedded within their cycling, walking, all of the normal things you would expect to see, the ecology corridors as well, an ecology park, and making sure that the community centre, the neighbourhood centre that I've just spoken about, has healthy retail uses, doesn't have those takeaways next to a school, though all of those things that you would expect to see. So Crest commissioned David Jarvis Associates to design a pocket Livewell Garden to showcase how some of those principles can actually work. So this had flexible movable seats and edible planting, quiet areas for contemplation, for mental health, and dementia friendly, those sorts of things. This was just a microcosm of how you would apply the Livewell principles into a really small pocket garden. And it actually got built. And there's a picture there. It was entered as a show garden in the RHS Hampton Court show last year. And it actually won a silver award. So I think you can just see there, hopefully, that this is just a tiny little pocket about how these principles can be applied into a garden, but they can be applied into any of the principles or any of the structuring infrastructure that is part of a new development. So essentially, the accreditation document that was finalised in late 2019. We were going to go for a launch early 2020, but obviously the current situation got in the way a little bit in that, but it's being approved and endorsed by councils across Essex. It's been endorsed by the Essex Planning Officers Association. It's available on the primary source of its availability is the Essex Design Guide website. So what also is really important is the monitoring and review, and we wanted to make sure that once we've actually gone to all of this effort to get this development through, and we've embedded all of this great work, we wanted to make sure that we can monitor it. So we've teamed up with Place Changers, who are working with us to use spatial data potentially through an app to collect data on how behaviours are changing and how we're going to use. And we're also potentially looking at using existing development to test that at the moment. So Place Changers are helping, and they've been awarded some funding from Innovate UK to help with these types of projects. So just in conclusion, the whole purpose of the Livewell Development Accreditation is to implement the health impact assessments, is to use that to shape new development and to embed that at the earliest possible stage. We think the accreditation process can add value to schemes in relation to how developers use that in marketing, but also how it impacts on the public purse and health and wellbeing outcomes. As we say, we think it's transferable anywhere in some respects. The principles are transferable. It does remain a voluntary scheme, and the policies of the local plan are requirements. So the policies, but the actual accreditation process is a voluntary process. So there's my final slide with some of the links. The final link there from Place Changers. They, as I say, have been awarded a grant, and they are looking for other sites to assess health and wellbeing outcomes. So the link on the screen, and we can provide that to the people on the call. The link will take you to an expression of interest form. So I think I'm maybe 2 minutes over, but I hope that's provided you with a quick overview, and I'll hand back to Pete. Thank you.
Fantastic. Thanks, Jeremy. Some good stuff there. Obviously, the pilot project with Crest and West Chelmsford's been run through by with Crest Nicholson, but to get another developer's perspective on the scheme and how it could help the development industry, we've got Andrew Taylor next, talking around sort of covering the Livewell Development Accreditation from a developer's perspective. So over to you, Andrew.
Thank you, Peter. So I've just been asked to give a few minutes really in terms of a developer perspective. I think just for confirmation, all the slides will be available to people at the end of the call. One of the things I wanted to cover, Jeremy's picked up on, he says, not being able to move on my slides. There we go. Is in relation to the number of different accreditation schemes that have been coming out, and really the push from government about the quality of design, the quality of new developments, yes, and the quality of building as well. And Jeremy touched on the fact that it's important that actually the outcome is as good as the planning at the early stage. We've seen a plethora of different guidance coming out. Pete mentioned Building for a Healthy Life, published yesterday, but guidance from the Woodland Trust a year or 18 months ago, National Design Guide last year, Design Council coming out recently as well. And a whole range of support for developers and councils in terms of how to develop schemes. And Livewell sits within that broader scheme, that broader desire for quality that I'd hope that all developers and certainly all councils and local residents and future residents of schemes want to see. The Livewell Guide itself takes you through a range of different pointers in terms of the things to be considered, and Countryside is very pleased that we've been picked on in terms of some of the photos to support the work, certainly here at Bewley. But the thing I wanted to get across was about that this is all about joint working. This is not something that local councils can do by themselves. This is not something that developers can do by themselves. And it's not even something that third-party quality review panels can do. This is a collective effort to work together to design schemes, iterative schemes throughout a process, and change and develop over time, and come forward to work together to deliver a quality scheme. I did want to touch for a couple of minutes on Bewley. Bewley is a scheme for 3,600 homes, which is on site now. It's about 800-900 homes occupied, schools open, neighbourhood centres open, and then I had to change my slide because now it's a newly adopted local plan with a further location. So well done, Jeremy, for getting your local plan across the line. But this hopefully is a testament to the way that planning can come together to deliver a healthy lifestyle for people, places where people can walk to and cycle and have the necessary facilities within a 10-15 minute distance from their homes, where people can actually live healthy lives and active and healthy lifestyles, as Jeremy referenced earlier. But this is, I should say, this is just good planning. This is not startling. This is something that everybody should be doing, and all the different accreditation schemes or national, regional awards that people can enter, before or after schemes being developed, all point to good planning, good joint working between developers and councils, and learning from experiences from other people to enable us to do better again in the future. And none of us from any parts of the development industry should be scared to say, yes, we got something wrong and we can improve about that going forward. The way that Bewley is set up, and you can see with different areas and large amounts of open space, but these are all connected by footways, cycleways. So actually the preference and the speed would be to walk or cycle rather than to drive in the car. But it's also set up so you can have, or eventually you will be able to have, the employment areas as well as the schools and community facilities, so people can be up and active and use the facilities in their local area as part of living in the new community. And I put this slide in really because none of these principles are new. I mean, these are the TCPA principles of a garden community, but actually they fundamentally underpin what the Livewell accreditation scheme is trying to bring forward. And if we can weave all these TCPA community points into new schemes and new development, actually we are creating good developments which hopefully will be able to achieve the gold Livewell accreditation, and not only that, but be a success for people living there going forward. This is what we feel we've done at Bewley in terms of the development of community there. And one of the biggest things is about making sure, we are developers. We are not necessarily the best people to develop communities, and we need to work with other people, whether it's local parish councils, local churches, and yes, the district and parish councils, to make sure that we are creating communities and getting people up and active and using the facilities that we are delivering. We can build the houses, we can deliver the open space and physical infrastructure, but it's more than that. And we need to remember that at the end of the day, developers will be going, however long that is, even on a large scheme like this, we will be leaving one day. We need to make sure the community can stand on its own feet and use the facilities that we have put forward. So just to conclude, these sort of design schemes, accreditation schemes, are great in terms of underlining good quality planning, pointing to good examples of places where we can learn from, but it aids the discussion and it aids the early design process and toing and froing between councils, communities and developers. And it should be a positive experience between all different parties, and it should be the fundamental building of strong relationships, but that needs to, or that will lead to the delivery of better outcomes, but hopefully also raising the bar for all developers in the world that we live in. But thanks so much, and I'm pleased to have been here as part of this launch for Countryside. Thank you. Pete, you're on mute.
Thanks for your time, Andrew. That's really useful to have your perspective from the developer side of things. Certainly, we've got loads of questions coming in that we'll pick up at the end, covering a whole different range of topics. So if you've got any other further questions of what you've heard already, or you want to run through, then put the questions on and we'll try and get through those, as many of those as possible at the end. Okay, quickly moving on. Next, handing over to Laura Taylor-Green, Head of Health and Wellbeing at Essex County Council, and Roy Warren, Sport England Planning Manager, to present around the wider scope of the project around the Essex Healthy Places programme. So over to you guys.
Thanks, Pete. Good afternoon, everybody. I'm delighted to be here today to speak to you about the work that we've been doing with partners across Essex to support the health and wellbeing agenda through the built environment. As Andrew, Jeremy and Pete have already said, much of the health and wellbeing work that we're trying to do is already embedded in placemaking. We know that places that promote better health and wellbeing are positive for our residents and our communities. We also know that there are multiple factors that influence our health, and some of these are intrinsically linked to the places that we live, work or socialise and play. And these can be improved through good placemaking. So what we've tried to achieve in Essex by working with partners is to work with those in the built environment, those who are developers, planners, placemakers, consultants, designers, to look at what they're doing with a more focused lens on health. including looking at what some of the priorities are that we need to be working towards to make improvements with health and wellbeing. And Jeremy's already touched upon this by the health and wellbeing strategy in Chelmsford. This journey really started through the last version of the Essex Design Guide when it was updated, when a theme was included on health and wellbeing, and also a further theme was included looking at the Sport England active design principles, which are designed to increase physical activity and access to sport and leisure facilities. Following the development of these sections, it was felt that we probably needed to go further to provide advice to those working in the built environment with a real focus on what they could actually do in practice to really maximise the opportunities that their developments were bringing forward. So this led to further work around developing healthy placemaking principles, looking at the evidence base that was in Essex. And this work has been led by the Essex Planning Officers Association. We've done this with the support of the public health teams from the County Council and our district councils, but also in partnership with our NHS colleagues and wider health and wellbeing stakeholders. And from this, a number of principles have been developed, many of which you've already noted have been included in the Livewell Accreditation scheme. So the key areas of focus for Essex are the design of homes and spaces, active environments and the application of active design principles developed by Sport England and endorsed by Public Health England, access to green and blue spaces, access to healthier food environments, access to education, skills, training and employment opportunities, access to NHS services and opportunities for self-care, how to develop communities and neighbourhoods, and also environmental sustainability, but with a focused view from health. These areas all contribute to the National Planning Policy Framework around the importance of promoting healthy and safe communities and also promoting healthier lifestyles. But we've now gone one step further and really looked at how we can make assessments around whether these principles are being embedded in practice. Health impact assessments aren't new in Essex. The Essex Planning Officers Association had a guidance note about 10 years ago, but we've recently updated this, looking at all of the evidence that's been coming out around the town and country planning principles, the work that's been done by the TCPA, the work that's been done by Public Health England, and other bodies that are interested in these issues. So the new HIA tool has been updated, looking at the healthy placemaking principles that we're interested in Essex, but also it cross-references to the Livewell design stage when you submit an HIA to achieve the first stage of the award. The other thing I would just like to say is that we've been working very closely with Sport England around how we embed some of our how we embed the active design principles that were developed. So I'm now going to hand over to one of our key partners, Roy Warren from Sport England, who will discuss how we've been working together to address this. Thank you.
Thank you, Laura. Good afternoon, everyone. As Laura's introduced me, I'm Roy Warren. I'm Planning Manager at Sport England. I've been closely working with Chelmsford City Council and partners on the preparation of the Livewell scheme. And I'd like to give a perspective from a national partner view. Public Health England and ourselves have been closely involved in the preparation of and delivery of the Livewell scheme to date. And we'd like to put forward our endorsement for the project and for its delivery. Just to give a bit of context, Essex as a county is doing a large amount of groundbreaking work on promoting health and wellbeing through the built environments. We have a number of, we have 12 local delivery pilots across the country. And what they're doing is we're looking to understand for each of these pilots how we can use local identities and structures to deliver a sustainable increase in physical activity. And what we're trying to do is test whether taking a behaviour change approach can provide groundbreaking solutions that could be replicated elsewhere. So we're providing support at quite a strategic level in Essex, and one of the strategic priorities of the pilot work is how we create active environments. So Sporting is we're looking from a physical activity element of the wider health and wellbeing agenda, and the Livewell project and the other projects that Laura's already mentioned fit within that umbrella of that pilot. And Sporting's biggest contribution to the whole active environments discussion is the active design principles, which have already been mentioned. And they set out 10 principles of how you can encourage developments to incorporate physical activity. I won't go through them in detail, but for example, walkable communities, multifunctional open space, walking and cycling connectivity. So all the work that's been done in Essex, the Essex Design Guide, which Laura's mentioned, that was the first design guide that we're aware of that embedded active design principles right throughout the guidance. The health impact assessment tool that's been mentioned, again, that's inbuilt into the criteria from the active design guide. The Livewell scheme is the next building block of the whole structure of toolkits and guidance that Essex has got to offer. And one of the priorities from the local delivery pilot was to develop a kite mark scheme that would reward and recognise developers, because we're keen to incentivise developers to deliver this in practice. And we felt that a kite mark scheme would be appropriate. And what's really good about it is not just about physical activity, it covers the whole health and wellbeing agenda. And what we're really keen to get out at the end of it is, obviously, while we're obviously keen to see developers get recognition and reward, what we want to see is what the learning from it is and what the outcomes are. So when we get to the end of it, the accreditation process, we'll get a number of case studies which will hopefully learn what works, what doesn't work, but so we can use that as good practice. And I think we're quite keen to work with developers, and where we've got good practice coming out of the Livewell scheme, we'd like to showcase it, to show how it does work. And what I want to perhaps re-emphasise what Andrew Taylor mentioned earlier was that what we're trying to do is, this is not something new. It is about good planning, good design. We're not looking for new facilities, something well over and above what you'd expect in any development. It's just looking at what you do, hopefully do anyway, from a different lens, looking from a health and well-being perspective, rather than perhaps just from, say, a transport or an environmental perspective. So it gives you an overview, but I'd certainly welcome developers get engaging in the programme, and we look forward to seeing submissions through the panel in due course. Back to you then, Pete.
Thanks, Roy. Thanks, Laura. That's great. There's lots of questions coming through, so I think we'll move straight on into the Q&A session. While Laura and Roy were talking, then you saw the Essex Design Guide website sort of being panned through at the back there. All the information is on there. All links will be made available to you at the end of the session, but also on the design guide, there's an opportunity to sign up to future updates. So if you do sign up to that, then you can be sent updates and new information that becomes available. But certainly in terms of the Livewell programme, slides are available on there, and we'll send on information certainly at the end of this session. So lots of questions have been coming in. The first one I'm going to go to is Jerry's question, which is about the stages when developers can certainly get involved in the programme. And maybe I'll send this one to Jeremy because of his work with West Chelmsford and Crest Nicholson. But can developers engage with the Livewell initiative at a very early stage, such as master planning or concept design? And from your experiences working with Crest on that site, Jeremy, how did that pan out in terms of the stages and when they got involved?
Yeah, I mean, the charter process allows the developers to get involved at a very early stage and provide and get input from planners and public health practitioners. And I think I saw another question coming in saying actually broader than that as well. So if there are opportunities for us to make links within local authorities to other professionals, such as possibly our sport and recreation, those kind of things, then there's opportunities there also. So yes, we would want to ensure that people contact us at the earliest possible stage to discuss that. And in West Chelmsford, because if it's our pilot, it was a pilot scheme that came through, those discussions about the structural elements within the master plan, the Livewell principles have been kind of embedded in those discussions. So yes, earlier the better with any of these things, I think, in terms of design. Thanks, Pete.
Okay, great. The next one, I think I'm going to ask Laura this one because she's spent a lot of time promoting certainly the HIA programme to the certainly the Essex local authorities. There's a question here from Matt around the reaction from the Essex Developers Group, and I know you presented them in the past, but can you give everyone in attendance an idea of what the buying is from the local authorities in Essex and also the developers, the Essex Developers Forum?
Yep, sure. So this work has been led by the Essex Planning Officers Association, who have been really supportive. So we've engaged with the chairs of the Planning Officers Association, but also the Policy Forum group, and I know that we've had engagement with the development management teams as well. Across Essex, we've had lots of support for this programme. There's certainly interest in health impact assessments. There's been interest in how we integrate health and wellbeing into local plan policies, but also around how we apply these into practice. We've presented at the Developers Forum and I've presented with you, Pete, around the Essex Design Guide and the themes around health and wellbeing, and everybody's been really supportive. I think that, as Jeremy touched upon, health impact assessments are often seen as another assessment that we have to do, but actually by having this accreditation scheme, it adds value because you can actually see how the assessment can be put into practice, and then it also supports the positives arising from the scheme and look at how they can positively impact on residents and communities and health and wellbeing issues that are happening in a place. So I think if you take all of that into context, that actually this is has real potential to be positive on the health and wellbeing of populations, so is being supported. Thank you.
Okay, great. I've got an anonymous question here around certainly the programme itself and the importance of health and wellbeing, but also with the COVID-19 question and how that started to affect how people live and work and travel. Michael, is this something you could pick up in terms of your work with Public Health England around the COVID-19 impacts and certainly these programmes and how it's kind of alive, shaping exactly how we plan for future communities?
Yeah, thank you for that. Well, I think we'll understand, and as a member of the public anyway, we do want things to change, and I think there's been surveys that show people would like to change from pre-COVID-19 in the way they live and work and play, and I think we need to make sure that the way that we design the environment changes with those evolving needs. So all I would say is I think many of the standards and things in the Livewell accreditation do help support that aspiration to improve quality of life, even with or without the COVID-19 pandemic. So I really welcome it. Really, does that kind of answer the question?
Yeah, I think certainly some of the work we're looking at the moment, where we're trying to promote and rethink about how town centres are reimagining themselves over the next 10 years. At the same time, trying to keep people socially isolated, so it's difficult to deliver both of those. Certainly juggling those two elements. Another question here around from Jason around developers. Some developers want to, well, obviously engage this, see the benefits of this program, see what they can get out of it in terms of promoting their sites as maybe a USP or differentiator between developments that don't necessarily have this Livewell accreditation. But the question is around what benefit is there to the developers that aren't conscious about getting the accreditation at all? How can we bring those sites forward to, it's a voluntary scheme at the end of the day, so there'll be people maybe like Countryside and Crest that are keen to benefit from this. What can we do to bring maybe the developers that aren't interested in engaging in the programme forward? Who wants to take that one?
Pick that up, Pete.
Yeah, you can take that. Yep, great, thanks, Jeremy.
So yeah, I mean, that was an issue that we thought about. However, in Chelmsford's case, we have these principles actually within as requirements, the principles as requirements within our actual local plan policies. So developers will need to do this, and for development over 50 units, they will have to submit a health impact assessment. So actually, in some ways, the process will be a requirement in any case. It's just whether they want to go for an award. That's the voluntary part. So I think actually policy is nudging or requiring a lot of this in any case. It's just that we felt that to go further and to actually champion the benefits of those policies, the accreditation scheme allows benefit from the developers part as well and adds value there. So we hope it's moving the focus, the gravity towards getting more people to be thinking about it rather than sort of the opposite of race to the bottom. Thanks, Pete.
Thanks, Jeremy. And a follow up to that question from Penny around the actual, so you're working with Crest Nicholson on West Chelmsford. Are you aware with your work with them any additional costs that they had to put into the scheme to achieve the Livewell programme? Well, obviously they did the garden, which was part of a promotion to the Livewell, but I think that's going to be a question that will probably come back in about what the additional costs to the developers to deliver this.
So I'll pick that up again, Pete. I mean, there would be additional costs. I think they're probably relatively minimal in relation to some of those factors that you've outlined, because through the negotiation of a master plan and through the pre-app process, the planning process will be asking a lot of those factors in any case. It's just wrapping those up into a more holistic way to focus on health and well-being in outcomes. So I think actually I don't see that being a significant additional developer cost. There is some cost, pretty minimal cost in relation to going for a panel, so there would be a charge for those sorts of things. But in relation to the additionality, as Andrew was saying from Countryside, this is just good planning. It's just wrapping this up into making sure that good planning achieves the health and well-being outcomes. Thanks, Pete.
Great, thank you. Again, moving quickly on, I've got a question here that probably is best for you, Roy. Certainly through your network of Sport England planning managers and your planning team nationally, is how could this scheme be used or adopted nationally to support good practice in other areas? Obviously, we spoke about a lot of the other tools out there at the moment. Obviously, Building for a Healthy Life launched yesterday, but can you, certainly through your network, Roy, mention or sort of answer that around how these programs could be picked up nationally?
Yeah, happy to do that, Pete. Yeah, I mean, this is the first scheme, kite mark scheme that we're aware of that's be based around health and well-being. So as far as I know, anyway, in England, there's not any other examples, but I see no reason why the Livewell scheme couldn't be incorporated anywhere else in England, because a lot of it is generic. It is, as I said, it's about good planning. It's not something specific to Chelmsford or Essex. You could take that and apply it elsewhere, which is why we've been keen to engage and support it. And obviously, you have to look at the local context and come up with a scheme that works with locally in that area and works well with local partners. But it's something. It's a project that we're promoting nationally to make sure there's awareness, so that there's any other local authorities, other partners that are looking to do something similar, we'd be keen to promote Livewell. And I can't see any reason why it can't be replicated, because a lot of it is very general. It's not Essex specific, so it's very replicable, I would say.
Great. I hope that answers that question. A couple of HIA questions, Laura, if you're happy to answer them. I've got one here from Anonymous around retrospective assessments for sites for HIA, whether that's possible. And then the follow-up one would be training for HIA assessments if people needed to learn more or learn how to understand how to assess them.
Yeah, I think I'll ask Michael to help with this question as well. There's a lot of guidance out there around the times you can do health impact assessments. Obviously, part of this scheme is that we'd like to do them in a prospective way, so that actually we can be supporting developers at the stage of master planning. So when the health impact assessment's done, that's the time when we can start really altering design. But equally, health impact assessments in a retrospective way have benefits as well, especially because we can, if it's as part of a phased development on the next build, we can really start looking at what's been done and what could be changed going forwards. If Michael could contribute to the training question as well, in Essex we're certainly supportive of providing training, advice and guidance to people around health impact assessments. If you go to the Essex Design Guide website, however, there is a lot of information. We've already provided a lot of information on the process of health impact assessments, and we signpost to additional guidance from other colleagues that have been working on this in other areas of the country. And of course, Public Health England are doing a lot of work around this as part of their Healthy Places those teams. So Michael, could I hand over to you briefly?
Yeah, so very briefly, I think the training question is really valid, because you need to try and implement it somehow, ensuring there's resources locally to do the work. All I'll say is, I mean, there's plenty of organisations and companies that do HIA training, so there's no shortage of training offers out there. I guess the issue is around whether there's resource within local authorities to deal with the HIAs coming in. And that's where I would say Public Health England would want to work with our regional colleagues and local colleagues to see whether we can support them, people like Laura and other similar positions across the country, to get involved in HIA reviews. But yeah, it's an ongoing issue which we'll try and address nationally.
Fantastic. Jeremy, I've got a couple of questions that I think will be best for you, certainly with the experiences of Crest and the pilot project. They're both from Graham. One's around highways and how we're speaking to the Essex Highways Authority around, some of the principles that they're trying to push for don't necessarily correspond to some of the Livewell programme. And he's also asked around the stages. So he's suggesting that to be more useful, it will be at site allocation stage when land is purchased. So then you can do an HIA based on that rather than maybe a retrospective one, or certainly once you're into the planning process, which will certainly affect what you're delivering on site. So can you give a summary for both of those, please?
Yeah, yes, absolutely. Well, I have a go. Highways, yes. I mean, obviously, I think, as I said in the presentation, sometimes there's some competing demands on the planning system. We are engaging with the Highways Authority about how we apply some of those standards going forwards, and I think garden communities is a good way in which that conversation will start, because some of the TCPA principles probably conflict slightly with some of the highways standards that have been applied in new development going forward. So we need to have that conversation to ensure that those highway standards aren't negating or conflicting with some of these principles. So that is a really valid question, and something we need to ensure happens through that kind of holistic approach to the master plan. On the second issue, I think what I first of all say is that, and we may not have covered this particularly so far, is that the accreditation scheme is going to be a moving feast. We want to get it out there, we want to see what the outcomes are, but it may well be that we tweak, and once it gets established and local plans are in place, and then hopefully becomes more of a norm, then yeah, you're absolutely right. If you're allocating a site, you kind of embed this in at the earliest possible stage, and if there were additional costs, then that goes into the land value and the way that site is allocated right at the beginning. But we have to start somewhere, and this is the place that we've chosen to start at this point in time. Thanks, Pete.
Okay, great. Another question here about the assessors. Who will be the assessors of the ward? I mean, Jeremy mentioned that there's going to be a bespoke panel set up, a Livewell panel, which I think includes a lot of the people here in the launch today. Can somebody pick up how the panel might work? Is that for you, Michael, or Roy? Do you want to get involved in answering this?
Can Jeremy answer that procedural type issue?
Yes, no problem. So as I said, the Livewell panel is a subset of the Essex Quality Review panel. Michael is our chair, and that will then draw upon potentially an urban design focus, and there are a number of panel members that we can draw upon. But I think it will be, a really focused review. Laura and Roy will be on the panel as well. So it will be focused, and also we're very much hoping it will be consistent, where we have the same people looking at this specific issue going forwards to ensure that there's that kind of consistency. Thank you.
Great, and I can see there's good question here. Matt sent a question in for you, I think for you, Roy, which was around how Livewell works with the new school agenda, because I know that you certainly in your day job comment on a lot of the ECC school sites. His question is, insofar as smaller schools could be delivered where there's an opportunity to share a new on-site sport and open space facilities areas in the master plan, this crosses boundary with county education and healthy living, and how they sort of can work together, certainly in some of the larger developments we've got coming up in Essex. Can you give us some response to that?
Yeah, happy to do so, Pete. Yeah, certainly recently we've been working, particularly in Essex, to look at how schools can incorporate active design principles, because even though we talk today mainly about larger residential developments, health and wellbeing and active design can apply right down to individual developments, including schools. We're doing a lot of work on primary and secondary schools in Essex, so it's something you can apply right down to that local level. So if you take a typical primary school, for example, which we'll be getting a lot of those in Essex and nationally as part of the growth agenda, it's about looking how you access the school, looking at car-free zones, how you enter the school, what facilities there are for cyclists, supporting facilities to encourage people to walk or cycle, looking at how the landscape in the space is not just about traditional playing fields. You know, can you create through the landscape, for example, mounds could be used potentially for running, for cycling, as viewing points. So there's lots you can do with a school to look about how you can design it for physical activity, not just within the school, but how you access it from the outside. So we're certainly doing a lot of sort of pilot work in Essex, and there is, as part of the suite of documents on Essex Design Guide site, there is some new schools guides, which includes specific advice for schools about how you can consider health and wellbeing, including active design. So I'd encourage you to have a look at that. But we're Sporting is more than happy to give advice from an active design perspective about how you can design schools to encourage physical activity.
Thanks, Roy. We're nearly at the end of the session. I just see there's a question around the designing out crime, Michael, and you're responding to it now. Is that something you want to sort of verbalise to the rest of the attendees?
I mean, I was not going to say that there are many other assessments, as well as the Secure by Design, that an HIA and other assessments have to fit with each other. And all I was going to say is, I think definitely in the screening and scoping stages of any assessment, the EIA, whatever it might be, it's where you could try and fit all these agendas together. But I don't know where exactly the Secure by Design accreditation would fit within the Livewell standard. But definitely there's a good question that we all have to be very mindful of different assessments out there that already exist within the planning process.
Fantastic. I think as we move to the end, we've got time for one more question. Yeah, one more here. I think this is around monitoring. You mentioned monitoring, Jeremy, in your presentation. Can you give us a bit more information about that? What are the proposed tools for accreditation, and which will help achieve successful monitoring once schemes are operational? And then that will be the last question.
Yes, thanks, Pete. So yeah, monitoring the outcomes is why so important, because we want to make sure that it achieves what what we want it to achieve. As I said in the presentation, we're working with place changes to try and work out a way that can be quite data driven. So we're investigating ways in which new residents on development can have apps that maybe measures their ability to and their mode of travel, those sorts of things, and how often they're in certain places within the new development. It's going to be kind of like a spatial data-driven monitoring process. I know in places like Vista, who have done some really great work on this, they have sort of infrastructure in their cycling and walking and jogging, and they can monitor the amount of beams that are cut by people, and they monitor that real time, so they can see the peaks. And they obviously saw a really big peak when the lockdown happened, with lots of people being out and about a lot more. So those are the sort of data driven opportunities that we're looking at. But we're also continuing to work with our partners and public health colleagues in the way that this can be best achieved. So I suppose in summing up, really, it's the most important part, and it's the part that we need to evolve and to get right to ensure that the outcomes are actually achieved. So it's a work in practice, but something that we're very mindful that needs to be really worked on. Thanks, Pete.
That's fantastic, and I think that draws us to the end of the session. Thank you very much for listening to the launch today, and on behalf of myself, Laura, Jeremy, Roy, Michael and Andrew, I wish you a good afternoon, and follow the links on the website for more information. Many thanks.
Thank you.